Good morning, Ma'am Nicole. I'm your nurse for today, Joanne Leslie Dasan. Is it okay with you, ma'am? Okay, so before we're going to start assessing her peripheral vascular system, I will identify or ask her using two identifiers, which is the name and birthday or other medical records. Before we start the procedures, I sanitize my hands first. Observe arm size and venous pattern. Also look for edema. Next, observe coloration of the hands and arms. Then, palpate the client's fingers, hands, and arms and note the temperature. Palpate to assess capillary refill time. Compress the nail bed until it blanches. Release the pressure and calculate the time it takes for color to return. Then, palpate the radial pulse. Gently press the radial artery against the radius. Palpate the ulnar pulses. Apply pressure with your first three fingertips to the medial aspects of the inner wrist. Then, you can also palpate the brachial pulses if you suspect arterial insufficiency. Palpate the epitrochlear lymph nodes. Use your left hand to palpate behind the elbow in the groove between the biceps and triceps muscles. Perform the Allen test. Use your thumbs to occlude the radial and ulnar arteries. And continue pressure to keep both arteries occluded and have the client release the fist. Then note that the palm remains pale. Release the pressure on the ulnar artery and watch for color to return to the hand. First, observe skin color while inspecting both legs from the toes to the groin. Inspect distribution of hair on legs. Then, inspect also for lesions or ulcers. Inspect for edema. Inspect the legs for unilateral or bilateral edema. Use a centimeter tape to measure in 4 different areas. Palpate edema. Press the edematous area with the tips of your fingers. Hold for a few seconds, then release. Palpate bilaterally for temperature of the feet and legs. Use the backs of your fingers. Compare your findings in the same areas bilaterally. Next, palpate the superficial inguinal lymph nodes. Palpate the femoral pulses. Then auscultate the femoral pulses. Position the stethoscope over the femoral artery and listen for bruits. Palpate the popliteal pulses. Place your thumbs on the knee while positioning your fingers deep in the bend of the knee. Repeat palpation in opposite leg and note amplitude bilaterally. Then palpate the dorsalis pedis pulses. And lastly, palpate the posterior tibial pulses. Palpate behind and just below the medial malleolus.